All right, let's continue talking about the fetus, the position, and how it's in mom's belly, and about childbirth. So, around 7 months pregnant, the fetus, the baby, will normally turn head down. That is called the vertex position. So, the baby prior to that can be in almost any position. Babies tend to move around quite a bit. Sometimes the head will be up here, sometimes it'll be on either side, etc. But around the 7th month, baby's head is going to go and start dipping into the pelvis. And what this is going to do is it's going to help to prepare mom's body for birth. This acts as a wedge to widen mom's cervix, to widen the vagina, to widen the vulva during birth. All right, so the head down position is a useful thing to get mom prepared for childbirth. The fetus is actually an a passive player in its own birth. Mom is doing all the work, baby is just getting kicked out and not really doing anything. So, expulsion or birth is achieved by the uterus contracting. Remember, the uterus is a bunch of muscles. Which is why when females have PMS problems, it's a cramping type of pain because the muscles in the uterus are tightening and cramping. So by mom's uterus and abdominal muscles contracting, that's helping to force baby out of the abdomen, excuse me, out of the abdomen and through the birth canal and eventually out of the body. The fetus might actually produce some chemicals that will help stimulate the labor contractions, but actually doing anything is not the role of the fetus. It's the role of the mom's body. So let's talk about contractions. Sometimes mom will have early contractions prior to like the main event. These are called Braxton Hicks contractions. These are usually relatively weak. So, mom, of course, is going to feel it. She's going to feel like she's going into labor, or at least the labor process is beginning, but it's not going to be the full on contractions that she'll feel once she goes into full labor. And these can happen over the course of gestation. So almost any time during pregnancy, she can feel these Braxton Hicks contractions. If I'm not mistaken, it's usually, yes. So it's usually stronger in late pregnancy. So closer to her due date, she'll have more Braxton Hicks contractions and they will get stronger. But this is what's called false labor. So it's sort of the body kind of prepping for it, but not really going through it. That's why it's called false labor. Eventually, those contractions will turn into those more powerful true labor contractions. And when you work with women, if you work with pregnant women or if you're with them, it's a noticeable difference. The way mom responds to the contractions is definitely different. So you can usually tell as the person observing mom while she is going through these contractions. The term parturition is the medical term for the process of actually giving birth. And it's marked by the onset of true contractions. So when mom has Braxton Hicks contractions, those are not considered the beginning of the childbirth process or the beginning of parturition. It starts when those Braxton Hicks contractions actually switch to these more powerful labor contractions that are the true labor. That is parturition. So remember we talked about estradiol and progesterone having a part in mom getting pregnant or the egg being fertilized, mom getting pregnant, mom maintaining the pregnancy. And now let's talk about their role in the contraction and childbirth. So progesterone and estradiol, remember estradiol is E2, that is the estrogen that you normally see throughout a woman's life outside of after puberty, and usually um, not during pregnancy. So the estrogen that was highest during pregnancy is E3, which is estriol. And so now we have estradiol coming back into play. Estradiol progesterone balance may be one factor in the pattern of increasing contractility. Progesterone will inhibit uterine contractions, but its secretion levels are going to start to decrease after 6 months. So 6 months, up to 6 months, progesterone levels need to be higher to maintain the pregnancy so that baby can stay in, cook a little bit longer, develop a little bit longer. But after that time, baby, mom doesn't need as much, and her body can start to slowly decline or decrease how much progesterone she produces. Estradiol will start to increase, and this is why you'll have the increase or the beginning of those uterine contractions. As the pregnancy comes closer to its end, there will be other chemicals being produced that will help in some part of the labor process. So you have chemicals from the posterior pituitary, namely oxytocin. So oxytocin is coming from the posterior pituitary, and oxytocin is going to help to increase there's going to be an increase in more oxytocin receptors. So as pregnancy increases, or as the pregnancy comes to an end, the body starts to prepare by producing more receptors. Remember that the number of receptors a body has depends on the person's genetics and what's going on in that body. So if the body senses a need for more receptors, then it's going to start increasing the amount of receptors so that it can receive signals from whatever chemical or process it is trying to receive information from. Oxytocin will promote labor. It'll do so in two different ways. One, it'll actually stimulate the muscles of the uterus, that myometrium lining. It'll also stimulate those fetal membranes to produce prostaglandins, which are synergists to oxytocin. Remember, a synergist is not something that is the main actor or produce the main action in whatever it is that you're looking for. It is something that is going to support that action. So in this case, oxytocin is the main producer, and those prostaglandins are going to help oxytocin increase the labor contractions. Now, the fetus might actually play some part in promoting its own birth. So it's an the passive player in childbirth, meaning that it's not going to actively crawl out of the uterus, crawl out of mom's body. Mom's body is doing all the heavy lifting in that situation, but baby may be producing some chemicals that actually help the birthing process. So during the birthing process, remember, it's a stressful situation. Baby's getting kicked out of its home, the only home it ever knew. Mom is having these contractions and she's probably ready for baby to come out. And so, everything is kind of stressed because now is the time and the contractions are happening and mom is feeling it and baby is feeling it. So just know that is happening. Baby's cortisol level is rising. Remember, cortisol is one of the stress hormones. So this cortisol rise in the fetus might actually help increase secretion of estrogen by the placenta. All right. Then the fetal pituitary is also going to produce oxytocin. This might also stimulate those membranes, those fetal membranes, to produce more prostaglandins. Then you'll have uterine stretching. So the uterus is continuing to stretch during the growth process of the baby, and as baby gets to almost full size, that uterine stretching is thought to help to initiate labor. So the stretching of the uterus is basically telling the uterus, or the uterus is like, all right, it's time for you to go. You're big enough. You got to get out of here. And so that stretching is could potentially be initiating labor. When mom starts having contractions, the first contractions are usually about 30 minutes apart. Usually around this time, mom or dad, somebody in the family is going to call the doctor, let the doctor know that she has gone into labor. But the doctor at first will definitely ask how far apart are your contractions. So if any of you ever get pregnant, once you start feeling contractions, make sure that you time how far apart they are, because the doctor is going to ask that. So they start off at about 30 minutes apart. And then as labor continues, they get shorter and shorter, and they can get down to every 1 to 3 minutes apart. The relaxation between contractions will help to increase blood flow, because remember, when you are tightening muscles, you're clamping down on the blood vessels that run through those muscles. So in order to increase blood flow, you have to relax the muscles so that you can have more blood flowing, you can have more oxygen flowing to those muscles, and beyond to wherever it needs to go. So that blood flow and oxygen is going to get delivered to the placenta and the fetus between contractions. Now, the contractions are strongest in the fundus and the body of the uterus, but weakest in the cervix. Let me go back and show you what that means. So I think I'm going to go back to the beginning of the PowerPoint where we can see just the uterus. All right. So this top portion, we pointed it out earlier, but this top portion is considered the fundus. The rest of this is the body. This is the cervix. So when contractions start, they're going to start up here. And as you can probably imagine, by having this constrict, this is more likely to actually start to push everything downward, because this area has very weak contractions. This area has very strong contractions. So this is not pushing against that one. This is pushing the baby down and out. All right, let me go back to that slide. So we talked about negative and positive feedback a few times this semester and last, and this is the case for positive feedback. So basically, remember that negative feedback is there is something going on, it sends a message somewhere else, the body tries to stop that first action. So it's going to do what it can to bring the body back to homeostasis and stop that first action. If your blood pressure increases, your body doesn't want to keep elevated blood pressure. So receptors are noticing the higher pressure. It's sending signals to release chemicals like renin, angiotensin, etc., so that you can actually stop that pressure and lower it. But in this case, your body will get the sense of that first contraction, and it doesn't want to stop it because it actually wants to get the baby out. So that first contraction will stimulate and cause reflex so that other things can help make those contractions become stronger and eventually push the baby out. All of this is going to help stretch the cervix even more so that the baby can come out with more ease. When the cervix starts to stretch, this will induce what's called a neuroendocrine reflex. Neuro meaning the nervous system, endocrine meaning endocrine system. So neuroendocrine reflex through the spinal cord, the hypothalamus, and the posterior pituitary, where the posterior pituitary will release oxytocin. This will be carried by the blood to other parts of the body. It will reach the uterus, and it'll stimulate those uterine muscles. So this is basically this positive feedback. You have cervical stretching, which produces oxytocin secretion, which produces uterine contractions, which produces cervical stretching, and it continues in a cycle. As the contractions start to increase, mom will feel like she needs to quote unquote bear down. Bearing down basically means she feels like she has to take a really big poop. All right, this is what bearing down is. It is the contraction of the abdominal muscles that will help to aid in getting baby out of mom's body, especially when you combine it with the Valsalva maneuver. Remember that Valsalva maneuver is when you take a deep breath, hold your breath, and then push as though you were about to go poop. Now, we experience Valsalva when we're about to sneeze. So think about it. When you're about to sneeze, you inhale, and then you sort of hold your breath shortly until you sneeze. All right. All of those are Valsalva maneuver. So the pain that mom feels, first, it's caused because you have those muscles contracting. And remember, I said that when the muscles contract, it decreases blood flow because those vessels that are running through the uterus get clamped off because of the constriction of the muscle. Well, that is going to cause a bit of ischemia to those muscles. It's not like myocardial infarction ischemia because it's not long enough to actually kill the tissues, but the tissues definitely will feel it and will respond to that decrease in oxygen because of the decrease in blood flow. The muscles are going to hurt. And like I said, restrict circulation. And that is why labor can be painful. When the fetus enters the vagina, the pain can become even stronger because, I mean, you have a whole human coming out of a space that wasn't stretched previously. So it's the stretching of the cervix, the stretching of the vagina, the stretching of the perineum, and sometimes the tearing of the perineum. I will show you an image a little bit later about where all this is, but sometimes the perineum will tear. So one of the things that doctors and midwives are paying attention to as mom is bearing down and baby is starting to crown and starting to come out is how much tension is going to be on the perineum, because you don't really want there to be tears if you can help it. It's much better for the doc to give mom an episiotomy. Now, word parts. Otomy refers to a cervical incision, not surgical removal, but a surgical incision. Episi or episio refers to the vulva or the pubic region. So an episiotomy is a surgical incision into the vulva or pubic area. This is where they basically cut the base of the vaginal opening. So the posterior side of the vaginal opening, they cut it a little bit to give a little bit more space for baby to come out so that mom is not tearing. You're like controlling that process. So here are the stages of labor. You have the early dilation stage. This is where baby's head starts coming toward uh, is in the vertex position so that the head is at the cervix. Because the head is there, it starts to wedge the cervix open a little bit more. That's that dilation. So this is the longest stage. It takes the longest time for it to have that first, that first dilation. You want to wait till it gets to about 10 centimeters, which is approximately the size of the fetal head, and effacement. So that's two things that they're looking for is the dilation, how big the cervix is opening, and effacement, the thinning of the cervix so that it's easier for baby to come out of the uterus and not have the thickness of the cervix be in the way. There's also rupturing of the fetal membranes and the loss of the amniotic fluid. So basically this is when moms water break because this membrane will rupture and allow the fluid that is surrounding baby to come out in preparation for baby being born. You have the next stage, which is the late dilation stage. This is when mom's cervix reaches approximately 10 centimeters. Usually happens in 24 hours or less with the first baby. And after the first baby, it can happen much sooner. So every subsequent birth could potentially be sooner than the previous one. Then you have the expulsion stage. That is where the baby starts to crown. So you start to actually see the top of the baby's head coming out of the vagina. The expulsion phase is usually 30 to 60 minutes in someone who is, if it's their first baby. I want you to look these words up, primi-para and multi-para, so that you can know the definitions. But primi, first, multi, everything after the first. So 30 to 60 minutes in the first baby, for the first baby, and shorter for subsequent babies. After the expulsion, after baby is out, the attendant in some situations will drain the blood from the umbilical cord into the baby. All right, so drain the blood from the umbilical cord to the baby. Now, umbilical cord blood is extremely helpful for baby. There's a lot of stem cells in the cord blood. You may have heard people on television talking about cord blood, and that's what they're talking about. It's the blood that is left in the umbilical cord once baby comes out. That is supposed to be for baby to help set baby up for a healthier present and a healthier future. But what science has found is that it can also help others in many different situations. So sometimes they will collect this cord blood and use it in other situations. I don't know the other situations. I haven't looked that up. But if you feel free to look it up, what cord blood is used for, and let us know. So then you have the placental stage. Placental stage, the baby is already out. Mom is probably holding the baby close, loving on the baby. Everybody in the room is happy, counting toes, counting fingers, making sure the baby is healthy. And now you have to get rid of the placenta that was left behind. So you still have another birth, so to speak, because now mom has to deliver the placenta. Of course, this is not going to be as much or as traumatic for mom because the placenta is just a ball of tissue. There's no bones, it's not as big. So it's not going to be as much of an issue, but do know that this is the next thing that needs to come out. This is called the afterbirth. The doctor or nurse or midwife that has delivered the baby, once the placenta comes out, they're going to actually inspect the placenta to make sure that all parts of the placenta are intact, because if there is any part, say this little piece stayed attached to the uterus, that can cause problems, that can cause infection. So that practitioner will be inspecting the placenta to make sure that every portion of the placenta has come out, and they don't need to go back in to scrape or retrieve the placenta off the uterus. Let's talk about this on the next video.